Uh, when I was saying that it is time for the old soldier to fade away, suddenly I find that my paper has been accepted for this presentation. Okay, let us go to the slides, please. Okay, go to the next. It's a case of a patient of 63 years old, female, diabetic, hypertensive, and under medical management of, medical treatment of for her coronary artery disease. And she suddenly got up at night with a severe pain in the right arm, and which was absolutely cold, and she was rushed to the hospital, where it was found that clinically there is a occlusion of the artery on the right hand, and beyond axillary artery, no pulse was palpable. And she was then there in the hospital was for the first time detected that she was suffering from atrial fibrillation. So it was, diagnosis was a thromboembolic manifestation, that is the occlusion of the right axillary artery, and she was hospitalized for 3 days there under oral anticoagulants along with heparin, and that did help her to reduce the symptom, but pulse didn't return, and she was treated clinically for 3 days. The angiography was performed next morning, and that showed the origin of both carotid arteries from the brachiocephalic trunk, highly tortuous right subclavian artery, which showed total occlusion at the level of the axillary artery. Faint late phase trickling of dye seen in brachial artery. Up to this point, the case was managed somewhere else. Patient was not under my treatment. To me, she came 2 months later with progressing pain in the right arm and development of Folkman's ischemic contracture on the right palm, and the fingers she couldn't, they were already deformed, and she couldn't hold anything. And I discussed with the patient, and I told her that, okay, I can try for a intervention. Can I show now the CD, film? Show the film, please. Oh. Huh. Yeah? Yeah. Sorry. So we took her up. I went with the, this is the patient. This is the first picture. And this is, you can see how tortuous it is. I couldn't approach from the brachial segment, from the femoral approach. And so I took the, punctured the right radial artery. Once I could cross it with a 0.014 guide wire, the job was easy. Segmental opening of the, dilatation of the occluded segment. And this was actually a short description, and I could show after that the procedure was done from the right radial artery, though it was not palpable from anatomical location. I could palpate it, I could puncture it, and then after, as you have seen, that after crossing the lesion, and one could open the artery. And I have done 6 months follow-up before I left India, and she was doing all right. The Folkman's ischemic contracture didn't revert it to absolutely normal, but she could hold the things as a housewife. She could hold her utensils and cook her food. And what conclusion I would like to say, that what is, I feel that clinically circulation in the arm is well restored now, having no difference in blood pressure with the other arm, but the effect of ischemic contracture has not fully recovered, though there is no more pain. She can fold her fingers and hold the utensils while cooking. I feel it was okay that intervention at acute stage was not done, which could cause distal embolization during procedure. However, more frequent clinical follow-up was necessary so that intervention could be performed before ischemic contracture had started. Thank you very much. That was it.
Thank you. You have 1.5 minutes for questions, please.
Do you think this procedure was necessary at this stage?
Seeing the result, yes.
The upper limb blood supply has got tremendous collateral circulation. Number one. The number two is that this lady has had already permanent ischemic contracture. So what were you trying to restore and what functionality you are trying to improve?
Okay, I have shown it from the result, I say, that a person whose palm was practically of no use, and she has definitely shown clinical betterment, and as a Indian housewife, she can now cook and she has no pain, and she came with symptoms. Otherwise, no question of treatment would have come. She came very much with symptoms, and she could, she was, every day she was taking a lot of analgesics, and I found that it has helped her, and so it was done well.
You did mention that you thought that in the first stage a procedure was not really required because of the risk of embolization. That's what you suggested.
Yeah, this is my thought. You see that when the next day, when the angiogram was done, one could see that was totally blocked, and perhaps one would have tried,
But one could have, in fact, looking at it, that she had atrial fibrillation, so probably it was an organized thrombus, which would have probably, gone up.
She is under anticoagulation.
So one would look at probably considering doing an embolectomy along with, combining it with the endovascular procedure if required. So if that could have been done at the first stage, that would have prevented all these complications which are there.
Yeah, we can discuss about it, but the patient was not under my treatment at that point. She came 2 months later with this pain and all these symptoms, and by that time the thrombi were all organized, and that we could cross and do the procedure. By the way, she is under anticoagulation. She was under warfarin before, and I changed her to dabigatran oral, 150 milligrams initially. After 6 months, I changed 110 milligrams BD.
So pardon my impertinence, but if you had just done a Fogarty for this patient, the results may have been, and the earlier the better. If you had a choice today and the patient had come to you not in a delayed stage as it had, but maybe earlier, would you not choose a Fogarty over putting some stents in that?
At the acute stage, yes. Had she been my patient, I would have consulted the surgeon and I would have taken his advice. If he wished to do a Fogarty, I would have told him, please go ahead. But the stage when she came to me, that was the point. That 2 months later, she had symptoms, but the thrombi were, they were already organized, and one could go ahead, and we got a reasonably good result. And a follow-up result is also good.
Thank you, sir.